Thank you all for your time today. My junior research project is titled A Function Restoring Intermediate Reconstructive Option for Treatment of Post-Traumatic Wrist Osteoarthritis. Wrist osteoarthritis is a degenerative change in the cartilaginous segment of a carpal bone, primarily due to a chronic non-inflammatory joint disease. Of note, these changes are often caused by a traumatic event that occurred some years prior to symptomatic presentation and almost always involve some aspect of the scaphoid as a sentinel segment. Most often, the symptoms are tolerated by the patient for many years prior to presentation until a functional impairment is experienced. The patient is presented with several non-surgical management options, including therapeutic rehabilitation, splints or braces, over-the-counter medications for symptomatic management, and local corticosteroid injections. It is not until the patient fails these conservative management options that surgical intervention is offered. Most often, the surgical option that is then available to the patient is a salvage procedure designed to manage the patient's symptoms as opposed to preservation of the wrist's functional and structural components in addition to symptomatic relief. The surgical option is then based on the carpal segments of the wrist involved, cause of the disease, and patient-related factors such as age and functional demands of hands at time of surgery. Post-traumatic wrist osteoarthritis in the cartilaginous segment of carpal bones has been found to be attributed to the scapholunate advanced collapse and post-traumatic non-union scaphoid fracture in 57% of cases. Current options for surgical interventions vary based on patients' needs and stage of osteoarthritis. Treatment has varied from localized osteotomies, partial carpectomies, denervation, proximal row carpectomy, four-corner fusion with scaphoidectomy, or total wrist arthroplasty or arthrodesis. To date, there has been little to no deviation from wrist salvage surgery to a true intermediate option with lasting efficacy. For this study, a Cochrane and PubMed NCBI literature search was carried out from 1939 to 2020. Proximal row carpectomies and four-corner fusions have exhibited early failure rates ranging from 5 to 12%, 50 to 60% complete pain relief, 50% maintained range of motion, and 80% grip strength compared to the contralateral limb, dash averages from 7.8 to 31, and mean visual analog scale scores of 2.3 to 2.9 postoperatively. Shapiro et al. Reported a meniscal allograft arthroplasty interposition carpal bone resurfacing repair of the TMC joints in 25 wrists. A VAS mean score of 7.7 reduction to 0.9 with a p-value of less than 0.01, increase in grip strength by 28.6% from baseline, and a dash mean of 42.1% improvement. By similar technique, Huang et al. Evaluated a small cohort of slack and snack wrists. These exhibited a VAS score reduction of 10 to 0.8, p-value of less than 0.01, and a total arc range of motion improvement of 45 degrees postoperatively with 15 degrees of flexion and 30 degrees of extension, exhibiting a p-value of less than 0.01. Additionally, one can extrapolate from the literature in knee meniscal transplantation, which has shown a survival of 95% at 24 months and 87% at 5 years. Even more promising data comes from a recent review by Samitier et al., who found on average a 7 to 14-year meniscal allograft transplant survival in greater than 95% of patients with the desired maintained functional level. This data can be biomechanically extrapolated to wrist reconstruction because axial load within the tibiofemoral joint can produce 3 times the body mass in newtons, which is distributed via hoop stress methods across the medial and lateral meniscus, as seen in Table 3. With no validated function-restoring intermediate reconstructive procedure for slack or snack wrists, a meniscal allograft arthroplasty procedure could hold immense promise for low-grade disease. This is an experimental procedure that our institution will evaluate in much greater depth, allowing us in the field to assess clinical outcomes, stability of graft life, physiologic response to the graft, and cost efficiency to determine its viability. We believe this technique will offer an intermediate function repairing, joint space preserving, and symptom relieving procedure.